Good morning. My name is Dr. Eric Donnenfeld. I am a clinical professor of ophthalmology at NYU and chair the Board of Overseers at Dartmouth Medical School. I represent the American Society of Cataract and Refractive Surgery, where I serve as chairman of the Cornea Clinical Committee. Most importantly, I'm here to represent the interests of my patients. I'm a consultant to excimer laser manufacturers AMO, Alcon, and Bausch & Lomb. I was an original FDA investigator for the excimer laser, and I've been performing laser vision correction for 18 years. Approximately 40% of the adult population in the United States is hindered by poor uncorrected vision. Among the most significant advances during my career has been LASIK. My passion and the passion of my colleagues has been to reduce the dependence of patients on glasses and contact lenses and to improve their quality of life. I have performed LASIK on over 800 eye doctors and their families. The reality is that following LASIK, the great majority of our patients see as well or better than they ever saw with their glasses or the contact lenses with which they were unhappy, the reason they chose to explore LASIK in the first place. As surgeons, we rejoice in our patients' success, and we understand the immense responsibility that comes with this option. We are deeply committed to both the well-being of our patients and the safety and efficacy of LASIK. LASIK has always been very safe, and with technological advances has continued to improve. The risk of infection over a lifetime is more than 100 times greater with contact lenses than with LASIK. The majority of our patients have less glare and halo after LASIK than before. However, we cannot be satisfied until all complications have been eliminated. Today, I will discuss dry eye. Dry eye is extremely common and is the #1 medical reason patients are evaluated by an eye care professional. Dry eye affects an estimated 55 million Americans and impacts our patients' quality of life, their comfort, and their ability to perform everyday activities. In an effort to better understand dry eye, the LASIK task force reviewed the world's literature on dry eye following LASIK. Today, I am presenting the preliminary results for the first time. There are 113 peer-review articles on dry eye following LASIK and 46 papers containing reviewable data. The papers were published in 13 journals representing 15 countries. The data represents over 32,000 eyes. 32% of these patients were diagnosed with dry eye before LASIK. A similar 35% had dry eye following surgery. The great majority of patients have complete resolution of their dry eye symptoms over a 2 to 4 week period following surgery. Severe dry eye following LASIK is extremely rare. Modern thin flap LASIK, advances in artificial tears, topical cyclosporin A, nutritional supplements, and the treatment of eyelid disease are improving outcomes. Ophthalmology is committed to developing treatment options, and there are many exciting therapies currently undergoing FDA evaluation that offer great promise not only to LASIK patients, but to the tens of millions of patients with dry eye disease who have not had LASIK. Conclusively, LASIK improves patient lives. I would like to close by recalling a remarkable young man I first met when he was 3. Nick had chickenpox like millions of other children, but in his case, the virus spread to his left eye. When he was 9 years old, he required a corneal transplant. Wheeling him into the operating room, this remarkable child handed me a note. I unrolled the crumbled piece of paper. I keep it to this day. The note read, "Dr. Donnenfeld, I sure hope you know what you're doing." True words of wisdom. The transplant went well, but Nick remained functionally blind in his left eye for 6 additional years until I performed LASIK. Nick graduated from college last year and doesn't worry about his vision because thanks to his corneal transplant and LASIK, his vision is now normal. Please allow me to introduce Nick Anderson and his mother, Clara. Nick, Clara.
We've got about 13 seconds.
Okay.
So.
You got 5 seconds, Nick.
I would just like to thank the family that donated the cornea to me and Dr. Donnenfeld for giving me my eyesight back. Thank you.
Thank you.
Hi. I would just like to say thank you to Dr. Donnenfeld and to God. Having a child who can't see, no depth perception, no peripheral vision, he can see, he can run, he can walk, he can participate.
Thank you very much.